Guys, someone asked me, sir, you explained about OCD, obsessive compulsive disorder topic, but you did not include what are the total number of types of obsessive compulsive and their related disorders. Okay, for that doctor who has just dropped me a statement like that, so for that doctor I am explaining that I will just simply tell the related disorder, obsessive compulsive related disorder I am telling for the doctor, and all the doctors please listen. Okay, so obsessive, see already I will discuss this topic. Okay, I don't just do it even more brief. I will just simply give the types of those things, types of and the related disorders. Okay, related disorders. Okay, so obsessive compulsion and relative disorder, obsessive compulsive and relative disorder. So the types of those related disorders, first one is obsessive compulsive disorder, OCD something, right? Second one is olfactory reference syndrome. You just remember these names, that would be sufficient. Olfactory reference syndrome. Body dysmorphic disorder, body dysmorphic disorder, just remember these names, that will be sufficient. Okay, fourth one is bodily focused repetitive behavior disorder, repetitive behavioral disorder. Okay, next one, fifth one is hoarding disorder, HOARDING, hoarding disorder. Guys, remember these types, this is very much important. You might get a question in INICET. I don't think like NEET PG, but in INICET you will get a question on any one of these. So first you should have the basics, right? Hypochondriasis, right? So these are the types of so-called obsessive compulsive and they're all related disorders. If you ask me simple mnemonic, I will simply say one mnemonic, you go for O2 B2 H2. Two O's is OCD and olfactory reference disorder, B2 is bodily dysmorphic disorder and bodily focused repetitive behavioral disorder, bodily focused repetitive behavioral disorder, and 2H is H2 is hoarding disorder and hypochondriasis. Okay, you heard it right? And in OCD is the main topic that most of the examiners love. I already said what is the treatment of choice. If it is drug treatment, you go for TCA, but if the TCA fails, which drug you will give? Chlorpramine. Which drug you will give? Anyone? Clomipramine. But tricyclic antidepressants, they might cause toxicity, TCA toxicity. So if clomipramine causes TCA toxicity, what is the drug of choice? What is the treatment that you will give? I already said, what is that? Which drug you will give? Sodium bicarbonate, which is given for TCA toxicity, tricyclic antidepressant toxicity. Now this is all pharmacotherapy, this is drug treatment. But OCD, what is the behavioral strategy? What is the psychiatric treatment that we give? That is called behavioral strategy. What is that strategy? Exposure and response prevention strategy. Exposure and response prevention strategy, E&R prevention strategy. Okay, what will we do in E&R strategy? We make the patient desensitive to the stimulus or the factor which is causing obsession or compulsion, right? We make the patient desensitive to that factor completely, and we will also make the patient habituated to the high levels of stress and anxiety. Okay, so that is the treatment for OCD, obsessive compulsive disorder. Okay, you got it? So you just remember this mnemonic. This mnemonic is very important. And all this disorder, in this disorder, body dysmorphic disorder is one of the examiner's favorite topic. Okay, we will discuss in the upcoming sessions.